Hello, my name is Julissa Mendoza, and I'm going to be doing the cranial nerve assessment. I don't have a volunteer with me just because some members in my family have COVID, and I didn't want to risk myself getting sick, so I'm in my room. So I'm going to be using my little puppet, and then I'll also be demonstrating on myself what would be assessed. So first we're going to go into cranial nerve 1, which is the olfactory nerve, which is also known as the sense of smell. So when you have the client, you're going to say, okay, I'm going to have you close your eyes. And then the client's going to go ahead and close their eyes. And I'm going to put something in front of your nose, and I just want to have you take a deep breath in and then tell me what you smell. So in this case, I'm going to be holding vanilla extract. I'm going to hold it in front of the client's nose and then breathe in and go ahead and tell me what you smell. Vanilla extract. And for this nerve, you want to make sure you present something that is not bad smelling or nasty, just because it could mess with the client smell or maybe gag reflex. And then for the second cranial nerve, it's going to be the optic nerve, which is going to assess the confrontation visual field, which is their peripheral vision. And then 2, you're going to do visual acuity, which is the Snellen chart, to see if they can see, and if they have 20/20 vision, 20/30 vision, just seeing their vision. So I'm going to have my client stand in front of me, and then I'm going to have them arm's length, and then I'm going to have them face towards me. And so I'm going to tell the client, go ahead and cover your right eye. So they'd cover their right eye, and then I'm going to go ahead and cover mine. I'm going to cover my left, I'm going to cover my right. And then I'm going to tell them, go ahead and make sure you look at my eye, and you're going to tell me how many fingers I'm holding up. So while I'm doing this and the client's holding their eye, I would hold up a number with my fingers, and they would tell me 4. Or if I held up 2 fingers, they would tell me 2. But the whole point is for them to be looking at your eye and not looking at your fingers. Then for the Snellen chart, I'm going to have the client stand 20 feet away from the chart. So if the chart's this way, and if the client wears glasses, I'm going to ask them to wear their glasses during them reading the Snellen chart. So then I'm going to have them cover the right eye and see what they can get to, what line. And then once they tell me that line, then I'm going to have them repeat it on the other side. And then based on what line, it would determine the vision. So 20/20 vision, 20/30, 20/40, 20/50, and so on and so forth. So yes, that's for cranial nerve 2. And then for cranial nerve 3, it's the oculomotor nerve. And also I'm going to be going into cranial nerve 4, which is the trochlear nerve, and then cranial nerve 6, which is the abducens nerve. And so for this, we're going to be looking for involuntary shaking in the eye. So I'm going to hold a light pen to their eye. I'm going to be 10 to 14 inches away from them, and then I'm going to have the client move their eyes and not their head. So I'm just going to use my finger as the pen. So I would be this far, and I would have them just look at me and see how the client's moving his head. I'd only want them to move their eyes. Okay? And then you're just seeing if there's any involuntary shaking. And then next, we are going to see how their pupils react to light, if it responds and constricts. And then I'm going to just have them stare off to a different space. So I'm going to have the client look this way. And then I'm going to see if their pupil will respond and constrict on both sides. So I would hold the light, see if it constricts. Okay, good. Do it to the next while they're looking away. Then next, we're going to check for accommodation. So I'm going to have the client still stare off into space, and then I'm going to move that light pen toward the nose of the client and see if the pupils constrict as well, and if they cross when I point the light pen. So as I go closer, and I'm going to do it on myself, as I go closer, I just want them to keep staring. Okay. And then next we're going to be testing the cranial nerve 5, which is the trigeminal nerve, which is responsible for massification. So I'm going to have the client, I'm going to go ahead and have you clench your teeth and bite down. And then I'm just going to feel the masseter muscle, which would be right here in the client. And you will feel like a little ball. And then I'm going to also feel the temporal muscle, which would be up here. Okay, so should be able to feel that. And then I'm going to have the client open their mouth, which it's open, and see how they respond against resistance. So as we can see, the client's doing pretty well because the mouth's not closing. And that's it for that nerve. Next, I'm going to be doing the cranial nerve 7, which is the facial nerve. And this is going to be checking facial expressions. So I'm going to have the client close their eyes tightly and then open them up. So I would say, okay, I'm going to go ahead and have you open your eyes and then close them tightly. And then open them again. Good job. I'm going to have you smile. And then I'm going to have you frown. And then puff out your cheeks. Okay, good job. And then next, we're going to cranial nerve 8, which is the vestibular cochlear nerve. So I'm going to have the client close one ear while I whisper something on the other side, and I want that client to respond to me what I just said. Okay, so I'm going to go ahead and have you close your left ear, and then I'm going to go ahead and whisper, and then you say back the words I say. Macaroni and cheese, correct. Okay, we're going to do the same on the other side. Fruit punch and cake, good job. And that is it for the cranial nerve 8. Now we're going into cranial nerve 9, which is the glossopharyngeal nerve. So I'm going to put some gloves on. I don't have gloves, so I'm just, pretending. And then I'd also have a tongue depressor, which I'm going to use my finger for. So, okay, I'm going to go ahead and have you say, ah, and I want to see if the uvula is going up. So, ah, okay, it's going up, good job. Okay, and then now I'm going to test the gag reflex of the client. So I'm going to go ahead and poke my tongue depressor a little bit back into the mouth. Okay, that's fine. Just want to test your gag reflex. Okay, good job. And then for cranial nerve 10, that is the vagus nerve. And that is if the client talks without hoarseness. And if they can swallow, which the client can. So they already are okay on that one. And then cranial nerve 11 is the accessory nerve. I'm going to have the client move their head side to side, up and down, and then shrug against resistance. So, okay, I'm going to go ahead and have you move your head side to side. Good job. Up and down. Good job. I'm going to put my hand on your shoulder, and I want to see you shrug against resistance, okay? Okay. Good job. And then for the last nerve, it's the hypoglossal nerve. I'm going to have you stick out your tongue. So the client's going to go ahead and stick out their tongue. And then I'm going to have you move it side to side. So, good job. And that is it for the cranial nerve exam.